So session 4, we're going to get into it. How are you guys going on the self-paced learning? So hands up if you're doing well. Okay. Hands up if you're having some issues. Okay, that's a good response. No one's having issues. Okay. Does anybody have any questions before we start this week?
Yeah. It says on the email that the like BW or something, and it was just the thing, and then but the other thing with the medallion, it says with the bronze medallion, it says assignments next to it too, but it didn't specify if you wanted us to do assignments.
Okay,
the other one.
What I think I've done is I've put some incorrect information in the email that's pertinent to the bronze medallion. After tonight's session, I will send out an email that has all the work that you should have completed and the next bit of work that you need to complete before our next session. Okay. And at the moment, we're working out when the next session is going to be, whether it's going to be next week or in 2 weeks' time. Okay, but we'll keep you posted. So at that point, I'll hand you over to your presenter, Gerard, and we'll get into it for today. Oh, Ziggy's in the
waiting room.
In the waiting room.
Okay, so Ziggy's in. Can we do a sound check, Denny?
Yes, all good.
All good. Can you just mute me in? You've done it? Denny's done it. Righto, because very distracting. Well, good evening once again, everyone. Good to see you all. We're all getting quite hairy and some a little overweight because the gyms are shut and the barbers are shut, but that's okay. I've heard some are still doing plenty of work in the surf, and that'll be good, so that when we get back at the club, you'll be pretty fit. More information on that later. So I am assuming that you have done the self-paced learning session 6. And so tonight, the first half in particular will cover that. And we've got some videos to look at tonight. And I'll be firing you some questions and we'll do a bit more CPR with the cushions again. Okay. So as part of tonight, scenarios. I don't know if that's a new word for you. But remember when I said the other week, just imagine you're on a roving patrol and you found a distressed swimmer. We call that a scenario when I throw a situation at you and you have to give a response. So in case that word's new to you, that's what scenarios are. We're putting you in a situation as if you're on patrol and you have to sort that out. A bit like a problem-solving sort of thing. Again, mannequins we'll be working with, I've mentioned. We will have some videos and they mention things that may go wrong during CPR, and then we'll cover the next session. Okay, I'm going to go forward through, I'm going to go forward through this and we'll go to the video. So if Denny, so you can see, they have prepared these training videos and they're very good. So what we're going to do, if you already saw them in the session 6, that's okay. Just have another look because soon I'm going to start asking some questions, okay? So we'll give Denny a moment now to just fire up the video, and he's given me a thumbs up, so it should come up very soon. Give us a shout if something's missing, maybe the sound or something, but
we are checking for danger to ourselves, each other, bystanders, and the victim. There is no danger. We now assess the victim's response. Can you hear me? Open your eyes if you can hear me. What is your name?
Squeeze my hands if you can hear me.
The victim has no response. Send for help. We'll now assess the victim's airway. Applying pistol grip and looking into the mouth. Mouth is clear. Applying backward head tilt.
Sorry guys, I'll start from the beginning. I thought I was sharing it.
Right, so it's been shared on that.
We are checking for danger to ourselves, each other, bystanders and the victim. There is no danger. We now assess the victim's response. Can you hear me? Open your eyes if you can hear me. What is your name?
Squeeze my hands if you can hear me.
The victim has no response. Send for help. We'll now assess the victim's airway. Applying pistol grip and looking into the mouth. Mouth is clear. Applying backward head tilt. Assessing the victim's airway. Airway is clear. We now assess the victim's breathing using look, listen and feel. The victim is not breathing normally. We'll now commence CPR. 1, 2, 3, 4, 5. 10. 15. 20. 25, 26, 27, 28, 29, 30.
1.
1, 2, 3, 4, 5.
Hey, I have a defib unit with me. Can you please confirm that the victim is not breathing and is not responsive?
Yes.
Okay, I'm going to apply the pads to the victim's chest.
1, 2, 3, 4, 5. 10. 15. 20. 25, 26, 27, 28, 29, 30.
1, 2.
1, 2, 3, 4, 5.
Communication is a skill you can strengthen by practice. There are two types of communication, verbal and non-verbal.
20.
Everything to do with our words is verbal communication.
5,
And there are several factors you need to consider.
Okay, analysing. Do not touch the victim.
Information useful? Is your message clear and precise? Is it
Shock is
respectful?
advised. Please stand clear of the victim.
Sorry, how a message is received. And it's a big part of verbal communication.
Okay, charging.
Communication is everything.
Delivering the shock now.
Expressions.
Shock delivered. It is now safe to touch the victim and continue CPR.
Our posture and facial expression.
The victim is showing signs of life and is breathing normally.
We'll now roll the victim onto their side into the recovery position, using the hip and shoulder roll.
One, two, three.
We'll now monitor the patient's vital signs till emergency services arrive.
Okay, just quickly, how did that come through for everybody?
Good.
You've just seen a very good video. It's very well planned when they put these videos on. So please make sure you have a look at them because they cover all the important things. If they muck something up while they're filming those videos, then they stop and they take it again until they make sure they've got a really good example of all the things that you have to do. So the videos are very good for training. So we're just going to briefly go over the key points. Now, in that video, they found somebody and the first thing they did was check for danger. Remember the guy moved his arms like this. If you do that when you're starting out, going down your primary assessment, I may not have used that term before, but we're actually doing a primary assessment on someone when we start to follow the DRS ABCD letters. So the first thing is to check for danger to yourself, and the guy was on the beach, so he was kind of safe, but he's just not moving. So responsiveness, this is very important. And you remember we use the acronym. Can anyone remember that acronym that I use? The 4 letters that remind us of the things. Cows. Very good. Can you remember what they stand for while we're on it there, Denny? Can someone?
Can you hear me?
Yeah.
Open your eyes.
What's your name? Squeeze my hand.
Okay, squeeze both my hands. And again, that's where the video is very good. That girl grabbed both of the person's hands. There's a reason for that. These details can be very important. So that girl said, squeeze both my hands, if you can hear me. And he also squeezed the guy on the neck there, because just say the guy's having a sleep there on the sand that they find. Well, something like that is going to wake him up and they'll think, okay, well, there's no problem. They don't know. So a little bit of pressure there on the neck is going to tell you what his level of consciousness is. If he starts moaning after you do that, maybe he has had an injury. But if he just wakes up and starts talking normally, he's conscious. Interesting thing, they had a good response in that particular scenario. So first of all, they found that he was unresponsive. So even with COWS and all those checks, he didn't give any response. So they had to go to the next letter, I should say, the 3rd letter. S is send for help. And on your patrol, goodness me, look what I have here. You'll have a radio. And we often think of the scenario when you're on a roving patrol, you'll have one of these. Can anyone remember the 4 Ps that we use when we send for help when we're on a patrol? I wonder.
Shout out.
I must be getting tougher with my questions, Denny. The 4 Ps, position, good.
Progress.
A little further down.
Person and position.
Position, person, problem, and progress. Okay, so in that case, they had a male who was down. They set his position relative to where the flags were, and they said he was unresponsive. And being unresponsive, their progress was they're about to check his airway. So the problem was he was unresponsive. The progress is we're going to check his airway and continue. Now, everyone on patrol knows DRS ABCD, so if you just say we're going to check the airway, they know you're up to here. Okay, so they check the guy's airway. Remember, pistol grip and head tilt to open the mouth. You're all going to be doing this very soon, okay, on your pillows. So I'm just going through it in a bit more detail this week. And they just check to see if anything's in there in the mouth. It's a visual check, so it's just if you can see anything in the mouth. Once you see the airways clear, because if there's something in there, you've got to get it out. But once you see the airways clear, time to check for breathing. This is the most important thing, because whether they're breathing or not determines what we're going to do next. In the look, listen, and feel, so you'll probably notice that there's another video coming up, and the girl's eyes that's doing the look, listen, and feel, they're focused straight on that person's chest. Now, I won't get one of us to lie down and we'll all look at their chest, but that's something I sometimes do in training, because about the only way you've got of telling if someone's breathing, especially if they're just lying down motionless, you've got to look at their chest and their ribs. So look, listen for the sound of them breathing, and look, listen, feel their breath on your cheek. Once again, the person wasn't breathing, the guy in the video, so they commenced CPR. So I'm going to throw another curly question at you. 4 main things that we are looking for. We're looking for the ratio of breaths to compressions, the speed or the rate at which we do the compressions, how far we compress the chest, how far down, and what's the 4th one? It's just escaped me. There's 4 things on a table, which has just eluded me. Rate, I think it's hand placement, but that's not on the table. Okay, we'll go for 3 then. My error. So questions are, what is the rate that you do the compressions? What is the depth you do the compressions? And what's the ratio of compressions to breaths?
Okay, let's go to Miller. How many compressions?
30.
Excellent. Okay. Olivia, what's the rate of compressions?
100 to 200 per minute.
100 to 120 a minute. But very good. Okay. Imogen, how far do you want to compress? Do you want to squash them into the ground? Do you want to give them a light touch? How far? So if somebody's that deep, how far do we want to compress? That's okay if you don't know it. Okay, Jaden's got his hand up. What is it, Jaden?
1/3.
Excellent. Good work. And did you remember what the fourth question was, Gerard?
Not yet.
You'll have to read up on that in the manual.
I will. Bad trainer. Okay. So we've covered some of the key details about the compressions and the CPR component. By the way, CPR, here's another big word. There's a lot of them in life-saving. You don't have to know them all. Stands for cardiopulmonary resuscitation. Cardio, heart, pulmonary, lungs, resuscitation. You're keeping them, remember I said artificially alive by making their heart beat, because it just can't beat on its own. They need a bit of help. You're making their heart beat and you're adding air into their lungs. And so this person would otherwise not be alive, but you come along and you can start keeping them artificially alive until better help arrives. You have a point, Denny?
Okay. So does anybody know how long until the victim starts suffering irreparable damage to their brain?
5 minutes.
That's not bad. Isla, what were you going to say?
3 to 4.
Yep, that's closer to it. Okay. Now, does anybody know how much oxygen is in the blood that you can keep somebody viable for by providing CPR to them? Do you have your hand up, Zoe? Because it's off screen. Okay.
No.
So they think that there's about 20 minutes worth of oxygen. So if you can keep CPR going for 20 minutes and then the person can be revived, you've got a good chance of them not suffering any long-term brain damage or anything like that. But you have to start the CPR early and keep it going for the 20 minutes. So you guys have been doing some CPR practice on pillows and cushions. How long do you normally go for before you start working up a sweat and getting hot and getting out of breath? Anybody want to volunteer that?
5 to 10 minutes.
That'd be a pretty good effort. 5 to 10 minutes is pretty good. Okay. Miller, is that a hand up or you just... No? Okay. So I'll give you an example of a CPR that the Sutherland lifeguards did. They did it for 45 minutes out at Potter Point, okay? And what they do is they have people lined up behind each other. One person will run through a few sets of compressions and then the next person between the two breaths will take over. So that's what you guys are going to have to start learning as a team, how to work as a team and do that, okay?
Thank you, Denny. Yes, working as a team. You'll notice too in some of these videos is they start saying what they're doing. So somebody was counting 10, 20, and 25, 26, and 30. That's fine to do that. It's a way of communicating in order to make sure everyone knows exactly what's going on. And teamwork is very important, as Denny said. Now, something which you don't have to do, but we mention it because if you're doing CPR on someone, you'll notice in the video, 2 other lifesavers, I think 3 actually, turned up with more equipment. And one of those things was the defibrillator or the defib. And you're probably familiar with it. There's plenty here at the club and there's some on patrol. And they put the pads on like this, one here on the top and one here on the ribs. Now, the reason we mention this, that's D for defib, is so that when you learn CPR, you'll realize that someone may come in and do this. May not be you, but it means you've got to continue CPR and you've got to allow for the defib to do its job, because there could come a point where if that person generally is had a heart attack and they're down for the count, as we say, they've just they need a real lot of help at that point in time. The defib's going to assess what the heart's doing, and the defib can tell you whether you need to continue your compressions or whether it can shock that heart back into life. Yeah, pretty clever little gadget. So that's the role of the defibrillator. So that's what you saw when those extra lifeguards or lifesavers came along later in the video and applied the pads to the person. We always say they go like a seat belt. So one up here, one there. I'll tell you the reason why. If you look at me side on and you look at that hand and that hand, the shock has to go across the heart. It's an electric shock and it's got to go across the heart. And that's why we put the pads in those positions, so that it sort of resets the heartbeat and your heart can start beating again. And that's a lot of information about CPR tonight, because this is a big night and we've got to add some. There's the thing. Cycles, hands in the center of the chest. I knew there was a table for it, Denny. 30 to 2. We had 30 to 2. Somebody got that right. We didn't mention your hands be at the center of the chest. Third, the depth of the chest, we got that. 100 to 120 compressions per minute is the rate that you press. And it says here, cycle every 2 minutes. So Denny mentioned how you're going to get pretty tired doing those compressions. Someone will come in and say, righto, after this set and the next 2 breaths, I'm going to come in and start the compressions. Get on the other side of the person and you're ready to start compressions once the 2 breaths have been administered by the person on the head. Okay. I haven't mentioned this so far. Just give me a wee moment, Denny. Oh, sorry, Benny. So far you've seen this guy, and that's the mannequin that we use at the surf club. But look, oh, here's one I prepared earlier, a baby. Let's have a look at what the table says. Adult, infant, this is an infant. Head tilt, oh goodness. Here, I've trained you last week to do full head tilt backwards. Remember how we used the pistol grip and the hand on the forehead? But look at the baby, no head tilt. Oh boy, it's a lot to learn with CPR, isn't there? Number of hands or fingers. So we were using 2 hands on the big guy, similar to that, doing our compressions. Once you get someone who's a juvenile, sort of kid sort of thing, you might only use 1 hand to get that third, the depth of the chest. But with a little baby, you're right down. I'll just show you to 2 fingers. Now you do have to learn to do this. So when we get back to the club, we're going to test you out on both the baby and the adult mannequins, okay? And you'll be doing your compressions like this. Okay, we'll just check another few slides in this presentation and then we'll be ready to start our CPR soon. I'll just check a few things. Right, now here's the guy using the mouth mask. That's something that we have in, goodness, in our bum bag. Do you remember the video? Let's have a look. You take these on your roving patrol, you know.
So can anybody tell me what we refer to the bum bag as?
First aid bag.
That's not a bad guess. Can anybody else give me a guess? PPE, personal protective equipment, because what the bum bag has in it is personal protective equipment. So there is a set of gloves, a face mask. I believe that we're supposed to have goggles in them, a whistle. Good. What else do we have in this word? Some bandages. More gloves. More gloves. Why might we have more than 1 set of gloves in there?
If more than one person needs to touch the body.
Yeah, that's a good answer. What's another good answer there?
The first pair gets dirty.
The first pair gets dirty. What about what I'm looking at now on my screen?
The hand.
My hand. Is my hand the same size as your hand?
No.
No. So I've got large sausage fingers. Ben Sutton has dainty little sausages on his hands. So we might take different size gloves. Okay, yeah, we've got the goggles.
And that's mostly, I don't know what that is.
And that's about it.
Oh, very good.
Yeah.
Well, so again, in that video, they all put their gloves on. If you want to impress the assessors, once we get down to that point of doing our assessment, you'll just pretend to put your gloves on. This is why you're doing the D right at the very start of it all. D for danger. You're already putting your gloves on and assessing the scene for danger. So that's why they're in the little first aid kit you take on your roving patrol. There's the mouth mask and the 2 fingers on the baby with your hand holding the head in the neutral position. So that's where the baby's different. I won't go into the reasons why, but the head is just like it's normally sitting there. You don't have to tilt a baby's head back. Right, complications. Now there's another video, I believe there, Denny, where they do a resus indoors, and I don't think the person comes good in the scenario. Let's see how we go here. Have you got that one, Denny? There it is. Complications during CPR.
Okay, we're going to check for danger to ourselves, putting on our gloves, checking for danger to any bystanders, and checking for danger to the victim. Do you see any danger?
I don't see any danger.
I see no danger. Let's check for a response. Can you hear me? Open your eyes if you can hear me. What is your name? Squeeze my hands if you can hear me. The victim is not responding. Can you please send for help?
Sure. Rescue, rescue, rescue.
Assessing the victim's airway. The victim's airway is not clear. We need to clear the airway.
Sure.
We need to roll the victim. On my count of 3.
Ready.
1, 2, 3. Tilting the head backwards and downwards for drainage.
I will clear the victim's airway. Airway is clear.
We'll now look, listen, and feel for breathing. The victim is not breathing normally. We need to roll the victim onto his back to commence CPR. On my count of 3. 1, 2, 3. One, 2, 3, 4, 5. 10, 15, 20, 25, 26, 27, 28, 29, 30.
1.
1, 2, 3, 4, 5.
I'm a qualified lifesaver. I'm qualified in use of the defib. Removing danger.
15.
What's the victim's condition?
20.
Not responsive and not breathing normally.
25, 26, 27,
Sign the
28,
chest.
29, 30.
I'm now turning on the defib unit.
3.
1, 2, 3, 4, 5.
I'm now applying pads to
10.
the victim's bare chest.
15, 20, 25, 26, 27, 28, 29, 30.
I'm now plugging in the pad connector.
4.
1, 2,
Analysing
3,
heart
4,
rhythm.
5.
Do not touch the patient. Shock is advised. Stand clear of patient. Delivering shock now.
We'll now check for signs of life. I'll look, listen and feel for any breathing.
I see no signs of life.
Let's recommence CPR.
1, 2, 3, 4, 5. 10. 15. 20. 25, 26, 27, 28, 29, 30.
So, are there any questions about that video? Did anybody notice anything particular in the video that the people did? Did anybody notice that the person on the head was controlling the situation? Did anybody notice that when they rolled the victim onto the side, the person on their head supported the neck and the head? So if there was a chance of a spinal injury, they were keeping the person nice and still so that there was no undue movement to the neck area. Any other things that we noticed?
When they were
Okay.
shocking, they all put their hands up.
Yes, so we've all seen that in the medical TV shows where everybody goes clear. Well, that's very important because if you're touching the victim when the AED fires, you're going to get a nice little shock yourself. And there's another thing that we work with on the beach that we haven't introduced yet, which is not part of the SRC course, which is flammable. Does anybody know what that might be? Oxygen? What were you going to say, Jaden?
That purple cloth they were putting over him.
The purple cloth?
They were wiping something on him.
Yeah, so articles of clothing, very important when we're doing AED and administering a shock. We have to be careful of the jewelry people wear. So necklaces, rings. If it's a woman, they might be wearing an underwire bra, which has a piece of metal in it. So we have to be conscious of those things when we're delivering the AED shock. But that's not something you guys need to worry about at the moment, but it's very good to be aware of it.
Thank you, Denny. So the two complications between the second video and the first one was the second one, the guy's airway was blocked, so they had to roll him over, clear the airway, and then they checked the breathing while he was on his side. That's okay. So you can check their breathing on their back if that's how you find them, but you can also check the breathing on their side. So it's interesting to see how scenarios can vary depending on what you find. We keep going all down the list when we do our DRS ABCD, but what if they are responsive? Well, then you start changing your response to what they're doing. We'll cover more of that later. Okay, the other complication in the video was that this guy was given a shock and he didn't come back. So the DFib told him to just continue CPR. Okay, if the patient comes good, then you roll them to the recovery position. And well, just a brief mention, the form has to be filled out. There's always paperwork, isn't there? As part of your assessment, you'll learn how to fill out an incident report form, okay? More about that later, but just keep it in mind. You'll see that in the assessment portfolio that you'll be getting soon. Always paperwork. Oh, here's another one. I missed Ambo. That's what you say to the people when the ambulance arrives. It's called a handover. Again, I won't mention too much about this at this stage. I think we've added a whole lot of new terms to our CPR. Usually you talk about it afterwards, and don't worry about those questions because it's time to get the pillows out, okay? So we're going to do a quick CPR scenario. So I've got my mannequin here and my pillows. We'll leave the baby there. So could you get your pillows? And we're just going to run through it. So will we go straight to the breakout rooms? What do you think, Denny?
Let's run through a demonstration first.
Good idea there, Denny. So a quick demonstration of how we do it, going right from the D for danger. So if this was my mannequin, I'll be putting the gloves on. D for danger, check, there is no danger. R, check for a response. Can you hear me? Open your eyes, what's your name? And squeeze both my hands. No response here. So because pretend we're on a roving patrol, we'll give the 4 Ps to the patrol captain. Wanda patrol, this is Wanda roving north, over. Wanda roving north, this is Wanda patrol, go ahead. Wanda patrol, we have a male who so far is unresponsive. He is 200 meters north of the flags, and we're about to begin assessment of the airway. Thank you, Wanda roving south, I think it was. Continue with your assessment and we'll send the defib and the oxy kit. Over. Keep us informed of your progress. Wanda patrol, over and out. DRS, we've sent for help. DRS, the next one must be A, check the airway. Pistol grip, palm on the forehead, tilt and look back. It's only a look. We mention this particularly in the surf club because there could be some seaweed or sand or something in there if they've just been rumbled in a wave. So open their mouth to check. This airway looks clear. So we're going to look for breathing. Look, listen, and feel. So I look for the rise and fall of the chest, listen for his sound of his breath, and feel their breath on my cheek. There are 3 ways you've got of working out if they're breathing. Most important one is the rise and fall of the chest. No breathing, so we commence CPR. And here we find the center of the chest. All those numbers and letters, what was it? 30 to 2. I forgot the 2 rescue breaths, didn't I, Ben? Oh, boy, I'm lousy. Sack the trainer. 2 rescue breaths, we'll go back to this. This is where we can pinch the nose. Again, you just blow to the side of the mannequin and watch the chest fall in between your breasts. Blow, and the chest should fall in between your breasts if you're doing good breaths and it's inflating the chest. Thanks for that reminder, Ben. I'll start the compressions now. How many do I do? Help me, somebody. How many? I keep losing.
30.
30. 30 compressions to 2 breaths. 27, 28, 29, 30. Here's my 2 breaths. Look for the rise and fall of the chest. And away we go. Now, this is where we said, if you get tired after you do about 5 cycles of the 30 to 2, someone else will come in and replace you. Typically, they go on the other side. And after you've done 2 breaths, they will start on that side. Well, from that side, but in the center of the chest, of course. And it's important that that just keeps going. And it keeps going for as long as it has to. There's only certain conditions that you stop doing it.
Can anybody tell me what conditions we might stop CPR? Let's go to, who's that? Defib, we might stop during defib, yep. What about you, Adelaide? When's another reason we'd stop CPR?
If he comes back to life.
Yep, if the patient recovers, excellent. Eliza, what's another reason we would stop CPR?
It's been like too long and like he's just not going to come back.
Okay. Are you qualified to make that decision?
No, it has to be like a medical profession, so like a paramedic or
a doctor.
Another reason why you stop is when a doctor comes and they take over.
Yeah, or the ambulance takes over. What's another reason you might have to stop? Let's go with Leah.
I was going to say the paramedic ones, but I hasn't said it, so I'm not sure.
Is hurting the patient from doing too much CPR one?
Okay, so that's not a bad guess, Miller. So here's the reality of it. When you're doing CPR on a patient, you're going to break ribs, you're going to pop cartilage, and you are going to hurt them. But if they live, having a couple of cracked ribs and a cracked sternum is much better than the alternative. Okay. Can anybody think of another reason why we might stop the CPR?
If there's danger.
That's a good one. If there's danger. So if there's danger, we need to reassess the situation and get the person out of danger and yourself out of danger. One more thing. There's one more reason you might stop CPR. Anybody, jump in.
If they start vomiting or something.
If they start vomiting, that's not a bad one either. That's getting a reaction from them. Okay, I'm going to tell you the last one. The other reason that you might stop CPR is because you're physically exhausted. So if you have been doing CPR for 15 minutes and you physically can't continue, you will have to stop. But when you get your breath back, you're going to have to start again until help arrives, okay?
Do people always break ribs when they do CPR?
They can, but more so on older people.
Chalky bones.
Exactly. Okay, righto. Okay, just two quick questions here. I've got the little baby here. Do we do head tilt on the baby?
No. No.
Right, well done. So I'll show you when it is a baby, it's just what we call neutral head position. And so you're just holding its head more or less how it would normally be. We don't do something like that in a baby, okay? And it's very important that we inspect the airway and do what we've got to do while its head is in the neutral position. And the other question was, do we use two hands or what do we use to do CPR on a baby?
2 fingers.
2 fingers. So we're holding the head in the neutral position. We're still a third the depth of the chest. That's all we need for this little tacker. Third the depth of the chest, 30 to 2. Everything else is the same. When you do your breaths, if you don't have a mouth mask, you actually cover the whole nose and mouth of the baby. That's if you get to that point.
A little tip here is small baby, small lungs. You give them a small breath. You're just going to give them a puff of air. You're not going to give them your full lung capacity. You just want to give them a little puff of air when you're giving a baby a breath.
Right, or you'll blow them up like a balloon. Right, so it's time to go to the breakout rooms, I believe, Denny.
Okay. So we're going to partner up, and what you guys are going to do is go through it in your breakout rooms, and you're going to work with each other and give each other some help as you go through it. We'll probably spend about 5 to 10 minutes in there, and we'll try to jump into the different rooms and see how you're going, okay? So I will get the rooms set up, and you guys can hop in there. And
How do I rejoin it? Oh, join. Oh, okay, okay. Bottom corner. Okay.
Let's bring the breakout room.
Oh my god. I'm gonna text someone.
Wait, I think everyone left the session. Because it's 7:02.
Maybe. Wait.
We're probably like the only ones on here.
I think we are. Look at the bottom, it says 3 participants. Hang on.
I think we're like the only ones
Oh
on.
no. He's in Otis's room right now.
Okay, let's rejoin the breakout room.
Okay.
I think
yeah,
they
he's
can
in
answer
the
the
room.
breakout room.
Okay.
Are we meant to be back or are we meant to still be in our breakout rooms?
Did you ask?
I'm speaking to Amy, Zoe, Ellie, and myself. Oh, it's Lachlan.
Did you ask a question?
No, for meant to be back. No, he's not there.
I don't reckon many people know that you're meant to press leave breakout room.
Yeah, no, I think they wait for the thing to come up. Like,
Yeah.
What me and Miller were doing.
Yeah, that's what we were waiting for.
yeah.
Is Denny on?
Is anyone talking or is everyone on mute?
We're just getting back to normal, okay? We'll be back in a second.
Okay, so does that mean I can talk?
Oh yeah, go ahead.
Do you need to talk?
I need friends. I'm so lonely. Where's Joe Doran? Yeah, there you are, Joe. Turn your mic on. Turn your mic on.
There you go, mate.
Hey, good boy.
So we good there, Will? Denny?
I'm just checking it out now.
What about
Right.
the board rescue team? Dane Sutton with a big grin on his face.
Me and Eliza, the guns.
No, you're not. You can't even run.
No, you have to see me and Zara on the surf rescue boards.
I nearly outrun you today. You did not. I gashed you and then ran in front of someone, and then you full on ran into them because you're that bad at running.
No, I ran around them.
Yes.
Yes.
All right.
Yes.
I think that's enough. Geez, you guys do need some socialisation.
Yeah, I obviously need to get out.
Hang on, I'm just going to let Leah back into the room. I think, Leah, Dan, is Leah back yet? Yeah, okay, there's Leah. Were you guys practicing together?
Yeah, but our computer died. Like,
okay. Okay. Right, no worries. Back to Gerard. We'll get him going.
Good. Okay, so they can hear me now. Are we coming in clear?
Yep.
And if you could just mute that delay that I can hear, if that's possible. Thank you, Denny. Okay, well done. Well, another big session of CPR. We did hope to try and cover rescue skills, but we run out of time. So what I'm going to do is just give you a very quick rundown of this next section in the training, okay? Rescue skills, you've remembered we've done our signals and things like that. You have to plan a rescue. You don't just go launching into it. And so there are some principles involved. We use two sorts of equipment, tubes, here's one, and boards, you know what they look like, the big yellow and black ones. But later on, in fact, if you did one of the training session 06, you will have found they threw you a really tough scenario where there was two people in the water and only two of you on a roving patrol that noticed them. And so the two people on the roving patrol had to make a decision about who was going to rescue who, because that meant that if all they had was one rescue tube between the two people, someone would have to do a rescue without any equipment. So I wonder who might do that between the two people. I'll give you a bit of a heads up. Probably the strongest swimmer is going to be the one who'll be better off doing a rescue without equipment if you're going to try something like that, if you find that you have to do something quick and act quickly. By the way, before you do your rescue, you're firstly going to give a message to your patrol captain what you're doing. You never just launch into a rescue without telling them back at patrol exactly what's happening and that you're about to enter the water. So that's very important, and that's why you have these on your roving patrol. In any case, you might see that the IRB is not far from you. You might see the jet ski is not far from that person who's struggling in the water. Oh goodness, aren't these handy to have? Because we can just tell the patrol captain who radios the IRB or the jet ski, and they take care of the rescue. That could be a better way of doing it. Here's Denny.
What other assets on the beach do we think that we have access to help effect a rescue if there's more than one person in the water? So let's go with Ellie. What's another piece of assets that we can get a hold of to help a rescue?
A tube.
Yep, tube. Aurora, what's something else we can use?
Board.
Board. Dane Sutton, what's something else that we have access to that we can use to effect a rescue?
Jet ski.
Jet ski? Yep. Okay, Zara Buckley, what's another asset we have access to?
Boat.
Boat, what kind of boat?
IRB.
IRB, excellent. Ziggy Lester, what's another asset we have access to in surf lifesaving that we can use to effect a rescue?
Pardon?
What's an asset we have in surf lifesaving that we can use to effect a rescue?
An asset.
Yeah, a thing.
Oh, thing. What, to like help us in the rescue?
Yeah. You're not alone here.
Did someone say rescue tube?
Yeah, somebody said rescue tube. We're at the hard end. There's not very many things left.
What about a board?
We've had a board. Jaden's got something. What do you got, Jaden?
Don't we have those UAV drones now?
Yeah, excellent. UAV drone. Okay.
And
What else do we have?
We could go old school and use the rope and the
Rope and reel.
Rod and reel? Rope and reel?
It's in the shed.
I'm rod and reel, I'm fishing.
You could use the helicopter if you needed it.
Helicopter, that was the one I was looking for.
What about a jet ski?
We got jet ski.
Oh, damn.
Okay. So the important thing is, if you don't send for help, none of that can back you up. Okay. So I want to give you an example of the SRCs on my patrol that a rescue they did 2 years ago. There was a 150 kilo man in the water.
Oh,
okay. And he was in the rip. We had 4 SRCs paddle boards out to him. Okay. None of them could actually get him on the board though. Right?
Why did he
now,
sink or something?
He was not doing well. He was a big man. He was 150 kilos.
That's heavy, bro.
That's heavy. He wasn't in good shape. But what the SRCs were able to do was to keep him afloat until other help arrived. But the only reason the other help arrived is because he sent for other help. Okay? So you're never alone. Okay?
Thank you very much, Denny. What a handful that was. 4 SRCs and a big guy out there in the surf. Well, Betty was glad to see those SRCs. So that's an interesting thought. Principles of a rescue. We don't just launch into it. We consider everything around us. We think, should I do that? Am I the best option to do that rescue right here and now? Or do I start to call for help? Maybe I can do something. Maybe I can point to the IRB and say, pick up swimmer here. I can signal the IRB from the shore and tell him to pick up a swimmer here. But then the IRB might do the rescue. So you have a number of options. We'll talk more about this, but just remember, you're a lifesaver. You got to start using this on the beach now. Carries and drags are something we can't do only because of the COVID restrictions. Post-rescue operations where you just have a bit of a chat about it, and then I'll carry on here. So here's the sort of thing I've shown you the slide before. Signals controlling the people in the water. Maybe she's telling that guy to perform a rescue. Principles. Oh, here's all the slides to mention the things. Yeah, here's some of the carries and drags, which we can't do only because of COVID. Post-rescue and a bunch of questions. Nah, we won't cover those questions now. I think we've had enough. So hopefully you will do the self-paced learning 06, okay? And that's where you'll get a bit more learning about the rescue planning, deciding to rescue, and then you'll get that curly scenario. Here it is. There's a distressed swimmer and a person in the rip. There's two of you 200 meters south of the flag, and that's all the gear you've got. So you have to work out based on that what you do to help the person. Okay. Denny, I think we're going to have to wrap this one up, and they've been pretty good tonight. I was impressed by the people, Kyle and Aurora, in my group, but Will has to get his microphone fixed. That's why we couldn't hear Will before. So I hope he does that before the next time we meet. So Denny, have you got some info on when we're going to meet again and what you're going to send them in the meantime?
Yeah. So I think we'll do another session next. Yeah. Okay. So next week we'll get together same time next Tuesday night, and we'll run through more scenario-based stuff. We are getting more information on restrictions lifting, so we'll have a better idea about training scenarios coming up. I will send out the list of homework that needs to be completed in the self-paced learning. That will include completing the online assessment and sending the certificate to the office. Okay, I will send the details of that in the email that I send after this session. Okay, but I hopped into about 4 different rooms and people were doing okay. I know it's really hard to do it over Zoom, but you guys are doing good. Okay, has anybody got any questions or any comments or any concerns that they want to bring up?
What are we doing on the e-learning?
So I will send out the complete list of learning that need to be done outside of the face-to-face on the Zoom calls, okay? Any other questions?
No.
No?
None.
Okay. I'll see you guys next week at the same time. Thank you for your attention. Thank you for engaging. Have a good one, guys.
Thank you.
Thank you. Bye.
Bye.
Thank you. Bye.
See ya.
Is Joe Doran still on this call? Oh, no, he left straight away.
But I'm still here. Don't you want to talk to me, Ziggy?
Yeah.
What'd you do today, mate?
I don't know. Not school in the water. Not school.
Not school. You and Cooper would get on well doing not school. How about you, Miller? What did you do today?
Nothing.
She talked to mute a lot.
Oh yeah, I went for a board paddle.
Okay, that's good.
Yeah.
And Zara, what did you do today? You spent the day in the water, didn't you?
Yeah, I got pushed in the water.
You got pushed in the water.
You didn't want to get her hair wet.
Oh.
So Zoe drowned her.
Oh.
I got abused.
Oh.
And
you
then
know
that
what this
was one
is?
of my running skills.
You know what that is, Zara? It's the world's smallest violin playing just for you. Okay, guys, I'll see you next week. Stay safe.
Bye.
Bye.